The data itself does take a data scientist most of the time. The algorithms are really not where the magic occurs, believe it or not. It's in the data itself.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. We are delighted to have Anthony Iacovone, the co-founder of BioSymetrics. BioSymetrics is a biomedical AI artificial intelligence company that has built machine learning technology to serve biopharmaceutical, precision medicine, diagnostics, and medical discovery companies. Welcome, Anthony.
Thanks, Bob. Great to be on here today.
In the Business of Healthcare podcast, we typically stay away from highly technical and clinical discussions and leverage information on significant changes that define some of the major problems associated with the business of healthcare. And with BioSymetrics, better, faster, smarter AI, biomedical machine learning, that sounds very, very technical. And I would assume that your background as the co-founder of this advanced technology company, that you might be a super uber geek or have a very long history in the biopharma space. So how did you get started in this high-tech enterprise, Anthony?
Yeah, I'm quite the opposite of a super uber geek, but I'll give you some history. So I've been an entrepreneur in the machine learning space for probably the last 12 years. Believe it or not, BioSymetrics was born from a company I founded in the ad tech space, a company by the name of Adherent. And what we did back in 2010 was apply machine learning that would dictate where, when, and how to serve an ad to a consumer based upon their behavior and some other data characteristics. So essentially creating efficiency in that space. So there's a lot of wasted spend in the ad tech space. The same goes for the biomedical field, and we'll talk about that in a few minutes. So basically, the premise was if we could apply this technology in one industry, could we apply it to another? And we began to do some research back in 2012 in and around potentially improving diagnostics, drug discovery, and some other areas in the biomedical field.
So, Anthony, we hear a lot about AI, artificial intelligence, and we hear a lot about machine learning. And I think these terms can be easily misunderstood. So for the benefit of our audience, can we give a little bit of a definition to explain where AI is and where machine learning fits into that from your perspective?
Yeah, I see them as almost synonymous in most cases. I think people misuse the term AI, artificial intelligence. Most of it is predicated on machine learning, and machine learning really is, advanced mathematics that allow you to make predictions from large sets or even small sets of data, right? So to better your chance of predicting an outcome. And that could be really in any industry. So in the biomed field, it's can we predict a diagnostic better than potentially a human might? It could be, can we predict a compound that has potential efficacy in the clinic much quicker with more efficiency than using, non-ML or AI methods. So I think overall, AI is being used because it's a fancy term, but most of it is predicated on machine learning with additional rules. There really is no true artificially intelligent computer which self-learns, and that's where, the industry is trying to get to. But again, mostly machine learning.
Recently, on 60 Minutes, there was an expose on artificial intelligence, and it featured an expert in the field from China, a person by the name of Kai-Fu Lee, and he was interviewed by Scott Pelley. And the way that Kai-Fu Lee explained the machine learning was that it does a very, very, very specific task very, very accurately based off a large amount of data. Yeah. And like you just mentioned, that AI, people like to think of it as a smart thinking, conscious type environment, but machine learning really focuses into one very, very specific area. In the case of Kai-Fu Lee, he's funded, dozens of AI companies, and his specialty there is looking at face recognition. And he basically identified Scott Pelley and the machine said that, hey, you're 61 years old. Identified him as a 61-year-old man as he's walking down the street. And Scott Pelley said, that's just so so not true. He says, I'm days away from being 61. So, and the answer was, how did you go about doing that? And it's because we have literally millions and millions and millions of data sets of images of people's faces. And so when you start to look at how you start to look at data in this space of the healthcare arena, I'm sure that is a big, big concern. And is the quality of the data what you do at BioSymetrics? I understand that organizing and cleaning data and preparing data is like 80% of the job. Can you tell us more about that and what's involved?
Yeah, I think a lot of folks talk about the promise of AI in many industries, specifically in healthcare, as, really changing the game and really changing humanity for generations to come. I think what we found pretty early into our research was that, the algorithms, while everybody talks about them, are going to solve some things. The data itself is really a bigger problem. And in healthcare, it's probably a bigger challenge than any other industry because you've got very different types of data. You have, EMR data. Your health records are, for the most part, very text-based, heavy text. You have chemistry very different than that. Genetics, again, is different. Imagery, you talked about imagery. Imagery is extremely difficult to bring into a machine learning environment. And then when you try to combine all of those, which is really what you want to do to effectively build a strong model that can predict something, it becomes very difficult. So we saw that as being a pretty big obstacle back in 2012, 2013. And we began to build a solution that really overcame that challenge. So make it very easy for a data scientist to bring the data into a machine learning environment without any bias. So taking some human bias out of the decisions in how you process that data, and then let the machine learning, do its job once the data was clean coming in, and prepared the right way. So yeah, the data itself does take a data scientist most of the time. The algorithms are really not where the magic occurs, believe it or not. It's in the data itself.
So we hear the term big data used quite a bit, Anthony, and some of the more recent in the news type items, when you hear about big data and AI and things of that nature, you may hear something like the Target stores, they can predict when a customer will expect a baby by looking at the data. They'll be able to look at data and say, we do predictive models. Is that really the key core competency of BioSymetrics, is to come up with predictive models in certain areas?
It is. And going back to big data, I think the promise in healthcare is so big because of the fact that there is so much data that we can use that's currently not being used to predict things like diagnosing something that may be overlooked by, a physician, right? Kind of helping in that process. The same goes for drug discovery. And these all tie back to, creating efficiency. It isn't that the machine is necessarily going to replace the human being, but it is going to effectively at some point do 95 to 98% of the work, where the human is really kind of given something to take a look at that's already been processed by a machine. And I think when we start doing that, we're going to start to see healthcare costs come down in many ways. And we can get into the details there, but both in drug discovery and diagnostics, because there's a lot of inefficiencies in both areas currently.
We see in the news there are a lot of new devices to generate data. Look at the Apple smartwatches, the other brands of smartwatches, the wearables, and all of that, with millions and millions of people, gathering data every day. I could see where big data analysis, organizing that data to make it more meaningful, being able to focus that into some, value creation opportunities would be significant. Do you look beyond just the clinical pharmaceutical industry with this technology? What are some of the other cases that you actually get involved with? Do you look, you mentioned earlier about EMR, electronic medical records, and you think about all the different types of data, like you mentioned, that is, composing one of those records, different data formats, different data types. You have a system which will help align and process that and make that ready for machine learning?
Yeah, so we really are agnostic to the data type itself. So at the end of the day, we're excited about wearables and how they kind of dovetail into other, call it clinical data points within for a human being, right? So when you look at, we haven't even scratched the surface. So when we look at things here, so genetics, let's talk about genetics for a second. So the ability for us to receive a full genome sequence for, a patient is, a pretty important data point when you feed that into a diagnostic model or even in the drug discovery side. But when we look at, the number of genome sequences that are out there, there's still probably less than 1% of the global population that's done it. So I think we're just at the precipice of this kind of big data world expanding pretty quickly. So being able to start with data like genetics and then add on clinical records like EMR records and clinical notes from a physician, adding that together with things like imagery. They may have taken an MRI or an fMRI or an ECG, and then bringing those data sets together to predict either, again, a disease state or basically better the drug discovery process is a big deal. And it is going to change healthcare for the better over the next 10 years.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
So if you have a lot of data and it's not been cleaned, it's not been arranged appropriately, and you run it into these models, then the models fail, I would expect. And the better quality of data would really give you much better results. It's kind of like the old GIGO. They talk about garbage in, garbage out. And I know in the university here, we think about curriculum and we create curriculum, and it actually, the quality of the curriculum has a lot to do with the student learning, the outcome. So, preparing information, preparing curriculum, et cetera, gives a better result. So I would expect that would be the case in terms of this data preparation that you deal with.
Yeah, it's so important in machine learning. It is the garbage in, garbage out is a very, very big factor in the success or failure of machine learning or AI. And in the healthcare space, it matters more, right? Because you're making diagnosis. You're actually also, basically using it in drug discovery, which is a long process. And what you feed the system early in is going to dictate the ability to predict whether or not a compound can become a drug earlier in. So it is really important to have a process around bringing that data in. We have spent painstaking amount of time developing a technology which really looks at how you bring that data in methodically and how that data, as you bring it in, affects the potential efficacy of a model that you're building. So it's more important than the algorithm itself. And I think it's been overlooked in our industry and really almost every industry. Pre-processing is more important than the algorithms itself. And I'll use an example. So in a case where we are looking at building a diagnostic for something like Alzheimer's and we receive let's say an fMRI image, there are certain settings that you want to make on that image when you're pre-processing it as a data scientist. And you use some human decision making to do that. So you may set a contrast at a certain level. You may set, how you remove skull subtract, so there's skull in the picture, and how you remove that. You'll kind of, just based upon, maybe literature or other things, make some decisions. What we found is, when you try to do that same setting for diagnosing something else, let's call it autism, looking at a brain image, it gravely affects the model. So you have to be flexible in how you bring that data in, how you clean it. You may set the setting for contrast at -2 versus 2 for one thing and 2 for another. So it's really, really important. And again, it's been overlooked, but in our work, we've seen that it impacts the model in a big way by really taking the time to kind of iterate through how you set that data up, getting it into the machine learning system.
So if I looked at a sequence of what takes place in an engagement, you're going to have this pre-processing. That's going to remove a lot of the biases in the data, hopefully. And, the pre-processing will probably yield a higher level of confidence in the data. And then as you run machine learning on that and you get the models, you can start to compare those models better to see which models are the best models. And then somewhere down the line, this all gets integrated together in a platform that allows you to tackle some big problems. So who are your customers? There's these clinical research organizations out there, the CROs and the pharmas. Is that one of your primary targets that you bring value to?
Yeah, so a couple of areas. Drug discovery, so pharmaceutical is a large area for us. Specifically because of the large cost of bringing a drug to market, right? It's an average of $2.6 billion based upon, what we read in the literature to bring a single compound to market. And the reason for that is the inefficiency around using data to make decisions early in the process and then before you get to clinical trials. So where we are strong as a technology is helping large pharma take the data sets that they have within house. And these can be large sets of images, things called high throughput screens, which are images of experiments done on cell lines, and genetics data that they have, proteomics data that they have, and some other data sets, and basically bring them through that same process that we just mentioned, right? So bringing it in without human bias, combining those, which has really been an Achilles heel for most companies. So it's easy to process one type of data, right? Bringing in imagery and having expertise there, but trying to bring 3 to 4 together, combine them, not use bias within that process, and then build models from that really is where there's a big gap in the industry right now. So we're seeing a lot of large pharma companies, medium as well, excited about what we're doing. They sit on the data. There's a lot of big data within house, but really not a lot of expertise in bringing that stuff together to help create efficiency in the drug discovery process. So that's one area. The second area is diagnostics. So working with hospital systems who don't have, for the most part, many don't have data science practices at all, but they have enormous amounts of data. So an example is we have a client that has 8 million patients, within its facilities, and just enormous amounts of data. This is clinical data coming out of the EMR. It's, experimental data. It's MRIs, fMRIs, ECGs, EKGs, and basically their hypothesis and again, it'll become at some point a proof point that they can build better diagnostics in the hospital to reduce cost, to treat patients, to affect outcomes by bringing this data together. And that's where we also see, a huge group of companies for us to work with.
Well, another area that I think is really important, and it really plays into this whole notion of population health and all the analytics that are taking place. We're moving away from fee-for-service pricing models and looking at population health, where we're trying to look at a larger population and understand some of their needs ahead of time, some of the preventative approaches to medicine. And I would think that a value-based care approach using this technology, wow, what would happen if you could plug into CMS and all the Medicare and all of the data there and find ways to improve efficiencies and reduce a lot of this noise into meaningful data that we could, base pricing on other things. It'd be pretty interesting opportunity.
Yeah, and we're seeing hospital systems thinking that way. So there's an enormous opportunity for machine learning and AI to affect the value-based care model in a positive way. And again, it goes back to there's enormous amounts of data, both on the payer side within the hospital system, on the clinical side and across the board, that just is sitting there and really not being brought together in a way. And I think that's one of the larger challenges that, the industry has faced over the last, few years, which is there's data there that's just sitting idle, not being used. I think companies are waking up. This is both on the pharma side and the hospital system side, and saying, what can we do with this data to basically reduce cost, create efficiency? And they both go hand in hand. I don't come from this industry, but walking into it and seeing the inefficiency at some of these large companies, it's eye-opening. I think AI and ML is not a promise. Effectively, with the data sets that exist today and applying AI, we 100% will reduce cost in drug discovery, reduce cost in misdiagnosis in the healthcare system. And if you look at those numbers, they're $2.6 billion per drug to bring a drug to market on average. 750, I just read this earlier, 750 billion is the estimate in cost because of misdiagnosis annually in the United States. So machines are there. The technology is there. It's there now, right? And AI. To apply that, I think we're going to see a great reduction in those costs on both sides.
Well, being that healthcare is 18% of the GDP, $3 trillion, highly fragmented business, and we're trying to extract out of that environment all this ridiculous excess cost and inefficiencies, I can see where that will be a big disruptor. Going back to Kai-Fu Lee, he says that AI will have more impact on civilization than electricity has. Wow.
I agree.
That's a powerful.
I absolutely. Yeah. Sorry, I didn't mean to cut you off, but I absolutely agree. I mean, when you sit on the front line and you recognize, I'll call it the untapped oil, right? That's out there, the data that's sitting within these hospital systems and pharmaceutical companies without the application of this, technology yet. And even in some of the cases that we've been able to work with companies where, we're seeing the effect of what we're doing applied, it's reducing, not only reducing costs, but we're talking about eradicating diseases, and we're talking about extending lives, right? And we're at that precipice. And I think the next 20 years, AI applied to healthcare I think we'll be talking about this, hundreds of years from now. This is kind of a tipping point to kind of the next generation of healthcare.
Yeah, some of the forward-thinking people say that 40% of the jobs, the ordinary repetitive jobs in the next 15 years will be replaced. There'll be jobs like drivers and chefs and waiters and shopping and things of that nature. And, when you stop and think about that type of disruption in the healthcare industry, and you know how politically charged it is right now, where we're looking at all the different costs associated with it, how can you extract from that industry a lot of these repetitive jobs and really allow us to focus into the meaningful efforts of healthcare, the real business of healthcare, and that is, longevity and quality of life, and removing some of these social detriments that keep people from having good healthcare because we're using technology to that effect there. So I have a question for you, Anthony. As a co-founder, how did you come up with the name BioSymetrics?
We like the word symmetry in terms of balance and balancing, how you bring data in and different data sets together and how they, at the end of the day, when there's symmetry within how you do things, you have a better outcome. So, and we basically, added the word bio in front and came up with the name BioSymetrics. We didn't like biosymmetry for some reason. We had kind of some votes internally, and we ended up changing it up a little bit. So it comes from the kind of those two words brought together.
Well, I certainly like the name of the company. I like the meaning behind it. And I really like the innovative opportunities that you're creating in this space. So it's been a great pleasure to have you on the Business of Healthcare podcast. And we look forward to learning more and staying in touch with you and some of the successes that you continue to have be shared with us. So any last comments you'd like to make at all about your company or the industry?
No, I just, again, I go back. I think to have the word out there, to understand that I think with these applications in AI being applied to healthcare, I think there's promise for folks who, have a certain disease state and are kind of hoping for, cures. I think we're getting there. I think we're seeing the stuff that we're doing applied on the ground in drug discovery that, some of these things that cures may have been 50 years away are really, within reach over the next 10 years. So I think it's an exciting time. I think we're gonna see some good things for humanity. Again, AI being applied the right way here.
Well, thank you for joining us today. We appreciate it.
Thank you very much.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.